we're going to start out with talking about anatomy. The kidneys are located in the flank area. The function of the kidney is to filter the blood to make urine. The urine then travels down two tubes on either side, which are known as the ureters. And the ureters empty the urine into the bladder. The bladder serves two functions. One, to store the urine, and two, to evacuate the urine to a tube called the urethra. The surface of the bladder is known as the mucosa. This is where the urine interfaces with the bladder. This is the first lining. The second layer of the bladder is known as the lamina propria. This is where the blood supply and the nerve supply of the bladder come in. The last layer of the bladder is known as the muscle. The muscle layer of the bladder is what we squeeze on or relax to be able to pee. Bladder cancer starts in the lining of the bladder. It occurs in people who are in their 60s or 70s. It is the 7th most common cancer in the United States. It occurs 3 times more commonly in men than it does in women. Tobacco smoking is the most common risk factor associated with bladder cancer. Exposure to chemicals and irritants can also result in bladder cancer. The first sign of bladder cancer is visible blood in the urine. Sometimes you may need to do a lab test on your urine to be able to figure out whether there's blood or not. Most of the time, there is no other symptom, although irritation while peeing can be a result of bladder cancer. When you first start talking to your doctor about blood in the urine, we will do a urine analysis. Then we'll move on to more sophisticated testing. The first test we do is known as a cystoscopy. In this procedure, we'll take a flexible scope, put it through your urethra, and look inside your bladder. This will allow us to see why there is bleeding coming from your urine. We'll be able to see tumors, stones, other causes of bleeding. We'll also do a CT scan, which will allow us to see what your kidneys look like, what your ureters look like, and also allow us to see more of the bladder. It can help us identify other causes of bleeding, or if there is a diagnosis of bladder cancer, it will help us identify if the cancer has spread outside of the bladder. The aggressiveness of the cancer is based on 2 things. The first thing is the grade, and the second thing is the stage. The grade of the cancer is either low or high. Low-grade cancers are not aggressive cancers, although they can be nuisance cancers. High-grade cancers are really aggressive cancers, which have the potential to spread outside of your bladder and become lethal. Staging has to do with how deep the cancer goes into the bladder wall. Remember, we talked about the mucosa, the lamina propria, and the muscle of the bladder. The deeper the cancer goes, the more aggressive the cancer is, and the more potential it has to spread outside of the bladder. Today we're talking about high-grade muscle-invasive bladder cancer. This is a very aggressive cancer, which has gone all the way to the muscle layer of the bladder. This cancer has a very high potential to spread and become lethal. Your doctor will have a very detailed discussion with you about the treatment options in muscle-invasive bladder cancer. We will review these options briefly today. There are basically 5 options. We will start from the most aggressive option to the least aggressive option for the patient. And these are also in the same order of how effective they are in treating your cancer. The first option is to undergo chemotherapy, which usually lasts about 3 months. Then you would get a break, which lasts about a month, and then you would have an operation to completely remove your bladder and other organs that are surrounding your bladder. We will also remove the lymph nodes in the area around your bladder. The second option is to undergo the surgery first, which would be removal of the bladder, and then based on the pathology results or how aggressive we find the cancer to be, undergo chemotherapy later. The third option is to undergo radiation therapy instead of surgery and get chemotherapy along with the radiation therapy. The fourth option is similar, except we would skip the chemotherapy and do the radiation therapy alone. The last option is to undergo aggressive resection of the bladder tumor from just inside the bladder without removal of the bladder. Now remember again, we listed these options from most aggressive and most effectiveness against the cancer to least aggressive and least effectiveness against the cancer.